Hello, everybody. My name is Megan Nakbal, and I will be making a presentation on behalf of South Asian Canadians Health and Social Services on type 2 diabetes. So, I will be talking about how we can manage type 2 diabetes, along with some options for using mobile health options. So, what is type 2 diabetes? Well, you may have heard that there are different forms of diabetes that include type 1 diabetes, type 2 diabetes, and gestational diabetes. But what all these forms of diabetes have in common is that the body experiences elevated blood glucose levels that result in complications. These complications can include stroke, eye disease, kidney disease, nerve damage, cardiovascular disease, in extreme cases, amputation of the limbs, or premature death. Now, insulin is the hormone that our body produces to regulate those blood glucose levels. And in type 1 diabetes patients, their immune system is attacking the cells that produce insulin. Often type 1 diabetes patients are diagnosed in childhood. That's often, but not always. And another form of diabetes is gestational diabetes, which is a temporary condition where pregnant women experience elevated blood glucose levels, and that's that's temporary and often ends after pregnancy. But type 2 diabetes is often diagnosed, and like I say, often but not always, is often diagnosed later in life, not in childhood, maybe middle-aged or in the senior years. But and like I said, not often, not all, but not always. But it's characterized by the body's resistance or insufficient production of insulin. So the basically the body is not either not producing enough insulin, or the body is producing enough but it's just resistant to it to metabolize those blood glucose those glucoses. So, but the good news about type 2 diabetes is that the complications that I had mentioned can be mitigated if one properly manages the condition. So my goal is to maybe give some tips on how one can manage their condition if they are living with type 2 diabetes, and hopefully can mitigate complications. So what is the significance of managing diabetes? Well, in 5 years, 12.1% of the Canadian population will have diabetes. And according to the World Health Organization, high blood glucose levels are the third leading cause of death in the world. Now, these complications can present a burden on the healthcare system, but these complications are serious and could result in permanent damage and premature death. So why, if it is possible to manage one's condition, we would we would like to do that before it gets to a stage where the complications are permanent and debilitating. So, using the 2018 Diabetes Canada Clinical Practice Guidelines, I looked at some guidelines from Diabetes Canada to present some tips on how one can manage their condition. So, Diabetes Canada suggests that one can manage their condition through glycemic control, weight management, nutrition, physical activity, cardiovascular disease screening, managing their blood pressure, cholesterol, medication, smoking, managing stress, and getting adequate sleep. I will give some tips for glycemic control and weight management, and if the other aspects are a concern for you, I would suggest you talk to your healthcare provider. So one living with type 2 diabetes should be regularly monitored with their healthcare provider, and their healthcare provider would probably suggest that they get their HbA1c levels tested every 6 months if they are meeting targets and 3 months for if they are not. So HbA1c is an indication of one's blood glucose levels over the past 2 to 3 months, and it's just an indication of how well their treatment is working. If they are not meeting targets, then maybe a treatment does need to be adjusted. Ideally, a target HbA1c level is at 7%, but that can be adjusted based on your condition, and your healthcare provider will let you know about that. But also, it is recommended that patients frequently measure their blood glucose with a blood glucose monitor, and that's just an indication of their blood glucose levels in an immediate time period. So your healthcare provider would help you set a schedule to regularly check your blood glucose readings based on your unique needs, but it is recommended that you are aware of your blood glucose levels. So around 80 to 90% of people living with type 2 diabetes are overweight or obese, and a reduction of even 5 to 10% of body weight can show improvements in one's condition. A weight loss can result in better glycemic control, better insulin sensitivity, like your body will use insulin better, can reduce blood pressure, and even reduce your cardiovascular disease risk. Some medications also have an impact on weight, such as insulin, metformin. There are other medications such as orlistat and ligaritide, which also have an impact on weight. So it is important that you do talk to your healthcare provider about your medications, and also talk about your goal, your realistic goals for weight loss, and from there you can come up with goals and better manage your condition. Nutrition therapy is also another line of defense with managing type 2 diabetes. Good nutrition counseling can reduce HbA1c levels, and also consider your unique needs. I know certain South Asians have special diets, such as they might eat only halal, or they might be vegetarian. So it is important that you do talk to your primary care provider, such as a dietitian, about your unique needs and your dietary preferences, and even your taste preferences, because it is important that you do enjoy the food that you eat, because if you don't enjoy the food that you eat, you will not be able to sustain a diet to manage your condition. So it is important that you do consider that your diet should be about 45 to 60% carbohydrates, 15 to 20% protein, 20 to 35% fat. Try to keep the saturated fats below 9%, and try to look for a diet for foods with higher fibers. Aim for it to get 30 to 50 grams of fiber per day. One should consider foods that have low glycemic index scores. So glycemic index is the ability for food to raise blood glucose levels. So it is important to talk to your healthcare provider, or like including your dietitian, about what are those types of foods. Also consider mobile health applications that allow you to keep a food diary, because they can show you how many calories you're consuming and what nutrients you are consuming as well. So mobile health applications are a good way to track your diet. Another aspect of managing diabetes involves physical activity. It is recommended that one should exercise about 150 minutes a week or more. That is associated with low HbA1c levels, and also improving weight and glycemic control. It also is associated with reducing your risk of cardiovascular disease, or premature mortality. So also consider how much you are sitting. So while it's great that you are exercising regularly, you should also make sure that you are moving regularly every 20 to 30 minutes. So stand up, like if you're sitting for a while, just take a walk, just stand up for a little while. If you're working at a desk, maybe think about getting a standing desk, or make sure that you are just taking frequent walks and breaks, because sedentary behavior is associated with increased insulin resistance. So be mindful of that. Good thing is that if you have a smartwatch, it can track your movement. And I have an Apple Watch myself. It often reminds me that I'm sitting too much and to stand regularly. So that's a good thing about my watch. And also, the watch can also look at different types of physical activity you are doing, such as walking or dancing or running or weight training. So that's also good, an option to manage your condition. So, as I mentioned, these are some aspects to managing type 2 diabetes. So, ensure that you are looking at all of these, and when you are talking to your healthcare provider about that. Here are some targets from Diabetes Canada, and like I said, these are just targets, but everybody's condition is unique. But these are some targets that Diabetes Canada suggests for managing one's condition. So try to keep your HbA1c levels less than 7. Frequently measure your blood glucose. Try to lose 5 to 10% of your daily of your body weight. Ensure that you are getting adequate carbohydrates, fat, protein, and fiber. Try to choose foods with glycemic index scores less than 55. Try to get about 150 minutes a week or more of physical activity, and look for variations of physical activity. You don't have to stick to one activity. Try to look for variations. Try to stand and move around every 20 to 30 minutes. Keep your blood pressure below 130 over 80. Keep your cholesterol low. And if possible, try to quit smoking. Take all medications prescribed by your healthcare provider, and make sure that you are getting good sleep. So mobile health options are another way one can manage their condition. So smartphones have built-in functionality through mobile applications and also wearable sensors. Uh, some ways that diabetes patients can use mobile apps is, some systems, provide text messaging. Others may have Bluetooth glucose and glucose meters. Um, and some might have like accelerometers built in their phone to track their physical activity. But something to consider is that a good application could track your blood glucose levels, your calories consumed, your physical activity, and your weight. So there are a lot of applications available. Just go to the App Store, and I'm sure you'll find a variety of them. So consider smartphone functionalities that use like functions within your phone, um, such as text messaging or calling you. Consider others that use social media. Consider some mobile applications, and consider which ones use Bluetooth continuous blood glucose monitors, where you might be able to just upload your readings onto an app. And some applications also integrate with other devices, such as blood pressure monitors, your weighing scales, or your smartwatch. So these are all just things to look for when you are selecting a mobile option for managing your type 2 diabetes. So that is all I have for today, and please feel free to leave any questions or comments in the comment box below if you have any questions, and I'm sure we'll be able to get you in touch with the great resources. So thank you so much for listening to my presentation, and if you need any help, please contact the number displayed or the email address displayed on the screen. All right, thank you so much.